Safety is paramount in healthcare, and overexertion injuries are the main cause of musculoskeletal injuries. Patient handling equipment, such as ceiling lifts, can be used for repositioning if the patient is fully dependent. The repositioning sling is used for boosting and turning of a patient, as well as for lateral transfers. In this video, we will discuss boosting. Ensure the patient is positioned optimally. To minimize exertion and to promote independence of the patient, have the patient assist as much as possible. To boost a patient, start by hooking up the straps to the ceiling lift carry bar, which should be positioned parallel to the patient. In most cases, you will be hooking up 3 straps at the top and 3 straps at the bottom on each side. The straps have 3 different loop lengths, and most of the time, it is a matter of preference for which one you choose to use. Choose the same loop lengths for all of the straps. In the interest of saving time, use the shortest loop. This may also be required if the ceiling height is low and becomes a limiting factor in how high you can lift the patient up. If the patient is large or bariatric, the longer loop is likely required. If a patient is in Trendelenburg position when lifted, lower the patient down and adjust top bar straps shorter or low bar straps longer. As one healthcare provider controls the lift of the patient, the other can support the head. You only need to lift the patient just high enough to clear the surface of the bed. Move the patient higher to the preferred location on the bed and unhook the straps. Straighten out the sling and return the ceiling lift to its docking station to charge the motor's battery. New St. Paul's Hospital may have motors that do not need to be docked for charging. One of the challenges that staff often face with ceiling lifts is that it takes too long. In some circumstances, to save time, this technique may be performed without hooking on all the straps onto the carry bar. It may be safe to leave the last 1 or even 2 straps off at the bottom, allowing the feet to slide gently on the bed during the boost. If the skin integrity of the feet are an issue, this may be contraindicated. Please use your clinical judgment or consult with your wound care specialist team. Please leave the sling underneath the patient at all times so it is ready and available for future use. Numerous pressure mapping studies have shown that there is no significant difference whether the sling is left on or taken off. Consult with your wound care specialist team if there are any concerns with skin integrity. There are exceptions to this rule and if specialty mattresses are used. Removing the sling defeats the purpose of reducing your exertion and increases the time needed for care, so keep calm and keep the sling on.